My name's Hannah Byrne and I work for Public Health England's National Workforce Development Team. So we lead on the programme management for the development of public health apprenticeships, which is the level 3, and the level 6 public health practitioner. We also run the Trailblazer group that developed the standard, and our team will be moving into the new Office for Health Improvement and Disparities within the Department of Health and Social Care at the end of this month. We will continue to lead the apprenticeship development and we'll hopefully be able to share new contact details for that soon. Next slide, please. Thank you. So community health and wellbeing workers are both a long-established workforce and been around for a very long time, but they're also one that's rapidly expanding at the minute, all supporting that increasing emphasis on improving health of local people and communities by preventing poor health and tackling inequalities. So the work is informed by the wider social determinants of health, which are the social, cultural, political, economic, commercial and environmental factors. And the broad purpose of the role as shown on the screen of the occupation is to work in partnership with individuals and their communities to identify and address health and wellbeing needs, improve health, prevent health and ill health, and reduce inequalities. So they do this by addressing the causes of poor health and wellbeing in the broadest sense, so looking at the causes of the causes, and taking a holistic whole person approach regarding physical, mental, emotional and social health and wellbeing and resilience. So they work with individuals, groups and communities to identify what matters to them and build on their strengths to improve health and wellbeing. They understand the local and accessible services and resources to which they can signpost people in the community to support their health and wellbeing needs. So whether it be about housing, mental health, bereavement, or through sport, creative, cultural heritage activities, just a few examples of that broad role. They also identify gaps in available services and resourcing, preventing individuals from achieving optimal health and wellbeing. And they do all of this by building relationships with local organisations and groups. This occupation is found in many different organisations. It's commissioned by a range of agencies, so that includes local government, NHS bodies, private sectors, voluntary, primary and secondary healthcare. There are a really wide range of roles in this occupation but they have the same core knowledge, skills and behaviours, but they may be in different settings or sectors. So you may have roles that have a particular focus or they specialise their knowledge, say in like an area like nutrition, but they will all fall under that occupation of the community health and wellbeing worker. Next slide, please. So the preparation for the standard began in 2017, where PHE convened a workshop to explore employer demand to support community-centred ways of working, which became, sorry, so that didn't make any sense. My notes were all over the place. So the preparation for the standard began in 2017, where we convened a workshop to explore employer demand for public health apprenticeships generally. So there was a lot of interest from employers, training providers and also professional bodies. So we've had involvement from UK Public Health Register. But we came away with the mission to set up 2 public health apprenticeships initially. So one was the public health practitioner apprenticeship and one was to support this community ways of working, which is this level 3. So we developed the practitioner standard first because we already have degree programmes and professional registration for practitioners in this space. But during that time, the landscape of the community-centred roles, the health system and the focus on personalised care and prevention has strengthened, and there's now an even bigger demand for this level 3 apprenticeship across the system. So in 2019, which was my first week at PHE, I've spent my whole PhD time working on this apprenticeship, we convened a workshop to explore the range of roles across the system, and this slide shows many of the different roles that employers described at this time. We wanted to understand if there was a USP, a unique selling point for the work of the frontline community-centred workforce that would help to define an occupation and what the core knowledge, skills and behaviours were, and understand what training and development was available across the system. So at this workshop, employers agreed that there was demand for an apprenticeship standard for the whole occupation, so opening up access to training, creating a national benchmark for community-centred roles that all ensures that the common knowledge, skills and behaviours are formally recognised and transferable between roles and organisations. So NHS England and Improvement are also developing competency frameworks for 3 new personalised care roles in primary care networks. This is the social prescribing link worker, health and wellbeing coach and the care coordinator, which are all supported by this apprenticeship. And there's also synergy with the Community Champions programme. So if you want more detail on the background, we do have a gov.uk collection, which is all of our different publications and resources. So if you Google apprenticeships that support public health careers, that will come up. The link is at the back of the slide pack when that's shared, and there's also links to the key policy documents associated with this development at the back of the pack as well. So we're going to come on to how apprenticeships work in this next section, but I'll just give you in the next section, but I'll just give you some key details about this particular standard. Alice, if you could actually skip 2 slides to slide 9. Fab, that's one. Thank you. This is the Institute for Apprenticeships website for the standard. So when you get the slides, this picture will be linked, so you'll be able to go straight to the page and bookmark it. The standard was approved for delivery yesterday, and this page gives full details of the standard, the endpoint assessment plan, funding maximum, level duration, and it lists all the employers involved in the Trailblazer group. So it is your go-to page, and our contact information is on the page as well if you have any queries. Next, please. So the apprenticeship standard, as I've just alluded to, is made up of the standard itself, the endpoint assessment plan and the funding band maximum. So the standard includes the duties and the knowledge, skills and behaviours, KSBs, if I keep saying that one. So that describes what's required when fully competent in the role. So when an employer is satisfied that the apprentice meets these requirements at 12 months, the apprentice is put through what's called a gateway, and the apprentice must submit a portfolio of evidence at this point, which is used to underpin the 3rd assessment method, which is the professional discussion. There are 2 other assessment methods which can be completed in any order as determined by the endpoint assessment organisation. So there's a 45-minute multiple choice test, which covers many of the knowledge elements of the standard, and then there's we've already mentioned the professional discussion. There's a demonstration of practice, which is a rotation around 3 stations. And we are in the process of speaking to endpoint assessment organisations about this standard, and we'll be sharing further details about that in due course. The apprenticeship funding has been confirmed at £7,000 per apprentice. This is the maximum amount that can be used from the apprenticeship levy. And apprenticeship funding can only be used to cover the costs of training and the endpoint assessment, so it can't be used for salaries or expenses or travel subsistence. Next, please. So just a few key points about the standard. So it is a generic standard, which means that on completing the programme, an apprentice will be employable by any of the employing organisations, and the standard can be used by any sector, so NHS, private, voluntary, local authority, and more. It's been drafted by a group of employers and training providers in what's called a Trailblazer group, which is employer-led, and it's been written for a wide audience. So school leavers, parents, teachers, carers should be able to understand the standard. So we've removed any specialised language, which is hard for us in public health. The standard is future-proof as well, so any specific tools, models, acts, legislations aren't included, and this is for the training providers to identify within the curriculum. Next, please. Oh, I think the slides are being a bit slow, but it is so I'll just carry on. It's a level 3 qualification, so this is equivalent to A level, and the qualification level doesn't equate necessarily to what's used by employers to differentiate pay grades or jobs within a hierarchy. So if you're familiar, thank you. So if you're familiar with the agenda for change bands used within NHS, for example, the social prescribing link worker might enter the workforce at an agenda for change band 5, but this may require a level 3 qualification as determined by employers. So the apprenticeship doesn't require the apprentice to have formal qualifications beyond the functional skills, as we don't want to exclude any candidates who may bring life experiences or personal qualities that are valued in these roles. And you can use the standard to upskill existing members of your workforce or recruit from the community. It is a 12-month programme before Gateway, and the endpoint assessment typically takes 3 months following completion of the learning. there isn't any qualification mandated as part of the standard. So all apprentices will receive an apprenticeship as a qualification on completion with a certificate from the Education, Skills and Funding Agency. Training providers will construct a course to cover the knowledge, skills and behaviours listed in the standard. They'll also work with employers to deliver any non-mandated qualifications as part of the delivery of the KSBs, if that is what is wanted by employers. Employers will need to pay for any registration, certification or assessment associated with any non-mandated qualifications, however. And there is no professional registration associated with the standard, but professional registration is being explored by NHS England and the Personalised Care Institute for those personalised care roles I mentioned before, so social scribing link worker, health and wellbeing coach and the care coordinator. And other parts of the workforce may wish to tap into other registration or membership. So an example of that is the Chartered Institute for Management of Sport and Physical Activity, if that's applicable to your setting or favoured by employers. So go to the next, please, Alice. I think that's it for me. So yeah, a bit of a whistle to stop tour of the standard. And I've been talking for a long time now, so I'm going to pass over to Kirsty and Liz from Health Education England to give you an overview of how apprenticeships work. And we can come back to any of this detail in the Q&A, and we'll look at the implementation plans. And if we can get Liz up on the screen as well. Thank you.
I don't know if people can see me. You don't need to see me, so don't. In fact, you might rather not see me, but it's fine. So welcome everyone. I'm Liz Sahu. I'm just going to talk a bit about sort of apprenticeships, and then I'll pass on to my colleague Kirsty Marsh-Hyde. Are you able to move the first slide over, Alice, please? Brilliant, lovely, thank you very much. I noticed there was a sort of few questions in the box about apprenticeships, so I'll just sort of touch upon what they are, but if you do want any further information, please just contact your apprenticeship lead or your relationship manager, and they'd be able to give you more details. So the government defines an apprenticeship as a job with training, which is sort of basically what it is. So 8% of your time is spent on the job in a workplace, and 20%, at least 20%, is what we call off the job. And that can seem like quite a lot. You're sort of thinking, gosh, 1 day a week off the job, but it can make up many different aspects. So it doesn't necessarily mean they're going to be physically away from work. They will spend some of that time potentially with a training provider, but also it might be that they're shadowing people in your organisation, they're attending meetings, they're networking, they might be working on their coursework. So there's lots of different ways we can make up that 20% off the job. It's hands-on experience and training plus vocational learning. So it's the complete package within an apprenticeship. The most important thing I think around these new apprenticeships, not the apprenticeships of old, is that they're employer-led. So they're very much about you as employers sort of working with the provider to make sure that it very much meets the needs of you and your organisation going forward. So they very much are employer-led. You can be any age, 16 plus. I don't think there's not an upper limit at all. So you can be any age when you start, and you can be brand new to an organisation, new employee that you employ as an apprentice, or they can be existing staff and you sort of put an apprenticeship wrapper around their role that they're on, or it could be people who are doing one particular role and then want to move and develop into a new career. So apprenticeships can meet all of that. You have to pay them at least the national minimum wage for an apprentice, which is £4.30 an hour, but Kirsty will touch upon that a bit more. But that is the minimum, it's not the maximum. So that's the wage you need to do for people who are on apprenticeships. If they're 19 plus, then you can pay that for the first year, and then they go on to the national minimum wage generally. Next slide, please, Alice. Lovely, thank you. There were some questions as well about how are they funded and the levy and everything. So these new apprenticeships are funded by something called the levy, and any organisation, be that a charity, public sector or Goldman Sachs, if they have a wage bill over £3 million, then they will pay a levy 0.5% of that wage bill into a levy pot, and that forms the levy that they will then use to pay for apprenticeships. So every large organisation usually has a levy pot. If you don't know who has that fund within your organisation, a good place to start would be, if you're in general practice, might be your practice manager or the CCG or the training hub. If you're in an NHS organisation, I would suggest it's usually sitting within perhaps HR, learning and development, and the same for social care as well if you're in social care. So there will be somebody within your organisation. You can use the levy fund if you have that. If your organisation doesn't have that, your wage bill is less than 3 million, then what we can do is we can try and source you a transfer from a large employer that has a levy pot, and that transfer will then pay for all the cost of the apprenticeship. In the case of the community health and wellbeing worker, the cost of that apprenticeship is £7,000, so it would pay the £7,000. That is just the educational costs. It doesn't fund any of the salary costs at all, so it's just the educational costs. If for whatever reason we are unable to provide and seek a levy transfer, then there is an opportunity for organisations to pay 5% contribution, and the government will then pay the 95%. So in this case, if I've done my maths correctly, I believe that is £350. So it would be £350 contribution, and the rest would be picked up by the government. So there's quite a few ways that things can be funded. Again, any questions, please speak to your apprenticeship lead. Next slide, please, Alice. Lovely, thank you very much. So I've mentioned here that if you're looking to do anything around apprenticeships, there's your apprenticeship lead is normally if you're a large organisation, or you might have somebody within your training hub who can support you with that if you're in primary care. There are also people within the Talent for Care team that Kirsty and myself are part of. Our roles are relationship managers, and I support the Midlands, but there's people, 7 of us, I think, in all the various regions, and Kirsty will show that at the end. So we can support you with the levy transfer. Ideally, we would like to see that levy transfer, if you quite want to come from your local area, your STP or ICS. What we don't want is those funds to not be utilised within the NHS. So ideally, we recommend that you seek a levy transfer there first. But again, if we're not able to find anything, we are currently working as well with some external organisations, and we've been very successful with the food and drink manufacturing sector, and we've been able to sort of receive some funds from them for various apprenticeships. Next slide, please, Alice. There you go. And this is just a slide of the transfers that we've been able to do so far. I don't know if you can see, but 2 notable ones on there. We had some money transferred from Morrison's, the large supermarket retailer. 2.1 million went to the Yorkshire Ambulance Service. We've had 300,000 from Coca-Cola into London Ambulance Service, but we've also done nurse associates into a GP practice in Staffordshire, pharmacies technicians into a GP practice in Leicester. So lots of different organisations have been receiving transfers through the service that we're looking to provide. There is also now a new pledging service coming in through the government, which hopefully will make it easier as well for us to seek transfers for you. So we're hopeful we're going to be able to support you in that way. I'm now going to pass on to Kirsty, who's going to talk through the remaining part of the slides.
Thanks, Liz. Right, next slide, please, would be lovely. Thanks. Lovely. OK, so I just wanted to say something about the additional roles reimbursement scheme, because those of you who work in primary care particularly should know about this, have heard about this as a way of funding roles and a way of transforming primary care delivery. And as you may or may not know, there is only one apprenticeship that's currently eligible under that scheme. So that's the trainee nursing associate. So currently, the community health and wellbeing worker isn't fundable through the R's roles, but I just wanted to mention that as a team, we're really proactively talking to colleagues within HEE and within Department of Health and Social Care about whether there is any flexibility on that. So that may be something that isn't available now, but it may be coming forward in the future as a way of funding salary or other costs around the apprenticeship as well. Next slide, please. So just a word about pay. Liz had touched on that before. There is a legal minimum wage that is £4.30 now. That's the national minimum wage for apprentices. But as I've said in the slide, most NHS employers pay above this, many pay significantly above this. So many employers within the NHS pay about 70% of the wage for the band. And if you use Agenda for Change, then that's called Annex 21. The link on the bottom of this slide will tell you more about that. In Agenda for Change terms, this role is around a band 4 or a band 5 usually. If you don't use Agenda for Change pay scales, then that might be a way that you think about having a benchmark. You might want to talk to people in your local system about where they think would be an appropriate level of pay for this role. And then looking at, progression as somebody gets more experience through the role or stays with your employer, it's worth thinking about. We always advocate for paying apprentices well, because we've seen the more you pay, the better it is to retain your staff, and that can make really great differences not only to you as an employer, but to the whole system, the whole local health system. Next slide, please. So there are various myths around the apprenticeship agenda. There have been since its inception, and some are still kicking around. So we just wanted to bust some of those myths, and more than happy to talk about this after in the Q&A as well. But maybe you've heard or maybe have an impression that apprenticeships are just for administrators. And that's absolutely not the case. There are great apprentice administrators, and you can do great work at level 2 or level 3 and in other kind of administration roles. But there's a huge wide range beyond that. This standard is a great example of one, a very dynamic role that works in lots of different environments. There are degree level apprenticeships now, there are advanced and higher level apprenticeships, and of the 350 roles that are available in the NHS, over 100 of those are available to train for via an apprenticeship. So it really is a big agenda with lots of different types of roles within it. The second one that we hear and that might be of concern to people on the call is that you can't employ an apprentice if you don't pay the apprenticeship levy. That's sometimes because people are not quite sure what the apprenticeship levy is or how you access it. As Liz said before, you will pay the apprenticeship levy if you have a wage bill of £3 million or more. So if you don't have that, then you won't be paying the apprenticeship levy, and you can fund your apprenticeships via a transfer, as we said. And if you are from a big employer but you don't know about your apprenticeship levy pot, or you're not quite sure, then it's worth speaking in your organisation to see if you have an apprentice lead. Lots of big organisations do have either an individual who leads on this work, or sometimes even a team. And us from HE, we're linked into lots and lots of employers around the country, lots of networks. So if you're not sure yourself, we might be able to talk to you about whether we know somebody in your patch and make those connections as well. Sometimes we hear that apprenticeships are for people who aren't academic. And this is and is not true, if you know what I mean. So if you aren't academic, then sometimes apprenticeships are very attractive to you because it's a very vocational and hands-on way of learning and training. But that doesn't mean that it's exclusively for those kind of people. Lots of apprenticeships have quite rigorous academic requirements, and they do involve study. They might involve applying yourself in ways that you haven't at school. So it's a misnomer to think that it's just for one type of learner or one type of person. I think we might have hopped forward on the slides because I think there was a couple of other myths on there. Could we just pop back? Sorry, is it Alice? Are you doing the slide? Or is that just me? Am I the only person who's on the next slide?
There is just a delay in when the slides come through.
Okay.
Give it a sec.
Oh, this is a test of what the other myths are for me, isn't it? Oh, wonderful, thank you. Sometimes there can be an impression that apprentices only work in large employers, and there are apprenticeships throughout large employers, both NHS and non-NHS in the country, but that's absolutely not the only case. So there are really thriving examples of apprentices working in small employers, in primary care and social care, working throughout systems, you know, really addressing workforce challenges and seeing about new ways of working. And that doesn't mean just people coming into careers or at the start of their career, but for career changes as well. And that's kind of speaks to the last myth that we've put on this slide, although there are other things that we could talk about, which is that apprenticeships are only for young people. So that's absolutely not the case. There's no upper age limit on apprentices, and actually apprenticeships can be a very good way of somebody transitioning within their career or an employer looking at their skills mix. So for instance, I'm very lucky to be on the judging panel for the National Apprenticeships Awards this week. We've been looking at all different people from across the country, and I've been reading great examples of people who were doing one kind of role and then at 40 or 50 wanted to change their career and are doing that via an apprenticeship. And that can really help when you look at the kind of people you've got in your organisation and the type of skills you need in your organisation. There may be people who always thought they wanted to do a different kind of role, but that it wasn't for them, or they couldn't access it, or they couldn't juggle it with childcare or other caring commitments. And apprenticeships can really help in that space, and they're a very flexible way of supporting colleagues. Next slide, please. So some other things that are useful to know about apprenticeships. So as part of an apprenticeship, lots of people gain what's called functional English and maths skills. So for instance, if you didn't get a grade C or a grade 4 at GCSE at school in these subjects, then studying them will be part of your apprenticeship. And as an employer, you know, this is a great benefit because it gives you somebody who is gaining greater confidence in these skills. They're practicing these skills, they're using it in a real work context. And there's lots of evidence to say that low confidence around maths and English can really impact on somebody's ability to deliver their role and deliver the role to the best of their ability. So having this support, and there's extra support from HE on that as well, and we can speak about that or direct you to resources around that, will really help with that individual and the skills mix in your organisation in general. Next slide, please. So just a word on recruitment, because if you were thinking of you know, employing a community health and wellbeing worker, but you didn't know where to go to find that individual, obviously you can look to your existing staff pool already. Are there people that you want to develop and that this would be a good fit for? But also, if you're going with outside of your existing staff pool, then you can work with the training provider. Often they will be involved in the recruitment, can help support with meeting candidates or working together on a job description. So I would absolutely have that conversation. You can advertise locally, as you do with existing vacancies in your area, either within the building or on local social media or using local forums. And that's why it says they, you know, use existing systems. Like you can add options to your existing recruitment, but you don't have to do something completely new and reinvent the wheel. An apprenticeship is an employee role, like another vacancy. So use the tools at your disposal. Next slide, please. Lovely. So this slide is our lovely team. These are our relationship managers, 7 of them, each holding one of the regions in England. So you can see everybody there and you can see the different regions. Obviously, we've got Liz with us on the call, and these are our other colleagues who each manage their own patch. very well networked into their areas, very knowledgeable about apprenticeships. No such thing as a stupid question. I would really recommend getting in contact with them, because not only will you be able to speak to them, but they will hopefully be able to invite you into existing networks in your area of people who are doing similar things. They might be implementing apprenticeships already, they might be quite far down the line, or they might be new, and that will really help increase your knowledge and your experience. When you get these slides, the underline here is a hyperlink to telling you how you can contact these individuals. So if you want the email addresses, then you just need to click on that hyperlink and you can get through to them. Next slide, please. So this is just one little kind of plug for our site. So those of us who work in the HEE Talent for Care team, we speak to this website called HASSO. So HASSO is Healthcare Apprenticeship Standards Online. It's a kind of bank of information about apprenticeships. This screen grab that you have here on this slide is our toolkit, which, as you can see, has all different information about apprenticeships, from organisational strategy to more details about funding, to more details about how you can cost up the price of the apprenticeships. Lots and lots of information in there, and might be really useful to spend 10 minutes just having a look through. I also just wanted to say there's a newsletter that comes out every week on a Thursday around apprenticeships, and it's really helpful, bite-sized pieces of information, very digestible. And signing up to that, I think, would be really helpful, because not just for this standard and all the updates on this standard, but if there's any other types of apprenticeships that you're interested in, then it can really help your knowledge in that way. Liz and I are staying on the call, and we're going to be around for questions. I'm aware that there are questions in the chat bar that I'll have a little look at now, but I'm going to hand over to Simon so he can tell you about procurement.
Can I just, sorry, Kirsty, can I just answer one of the questions that comes up quite a lot? It was just about clarifying about the R scheme and the social prescriber roles. The social prescriber roles can be funded through ours, but not if they're on an apprenticeship. Mm-hmm. So the apprenticeship ones sit outside of that, but the actual roles themselves do sit inside of that. Thank you.
Thanks for that, Liz. I think that's really important. Yeah.
Sorry, Simon.
That's all right. It's far more interesting listening to you than listening to me. Okay, thanks very much. Oh, we've got a slide that says implementation plans.
If we just flick through these ones, because I think we'll come back to them. Simon, you go. If we skip to when it changes to,
I can make up some stuff about implementation.
No, then we'll come back to this.
There
we go.
Okay, thanks very much. So Simon Dennis, Head of Commercial at Salisbury NHS. Most employers on the call will probably know us already, but we look after a lot of the apprenticeship and education procurements across the NHS and into the wider systems, local authorities and third sector. Next slide, please, Hannah. My one and only time to sound as intelligent as Chris Whitty, or to try to sound as intelligent as Chris Whitty anyway. Why Salisbury? So we look after a large proportion now of NHS spend, and we are a strategic partner to HEE, supporting them on activities such as this. So being an NHS trust, we have that employer's view of the sector rather than just having a guess at things. So we work across employers, professional bodies and trailblazers, and it's a great privilege to be on the trailblazer for this particular programme. And it's supporting employers at every level. So whether you're a single GP practice or an acute trust with 10,000 staff, you get the same level of support across. Next slide, please. Thanks. So in terms of this one, we work with HEE on national procurements for a large number of programmes where we need employers to be able to access high quality provision, knowing that the basic checks and everything have been done, and that you're looking at providers there who are able to meet your needs. This isn't us about telling you who you will go to. We'll be able to give you a menu, a framework of providers, and circulate their bid responses when you need it, so you could see all the background and course delivery methods, etc., that you need to make a decision. Next slide, please. And in terms of access, we work across local authorities, and we would encourage, particularly with the advent of ICSs, and in standards like this that reach across a number of providers, potentially looking at ICS or regional collaboratives coming together is likely to be a good way of you looking for your provision and agreeing provision. And again, with all apprenticeships, it's those two little words, employer involvement. It's absolutely key from the start. And as others have said, apprenticeships are very much yours to design the pathways and the structures that you need within the overall KSBs of the standard. Next one, please. I think we may have some providers as well, actually, who are employer providers who are potentially looking at delivering this to their own staff or subcontracting. So there's reasons for that as well. Why do we do a procurement bit? Well, it's apprenticeship levy is classed as public money. But actually, for me, it's a bit more fundamental in that it's actually helping you get that quality of provision. So the financial compliance bit is almost a benefit, if you like. Coming through us to order protects you from detrimental clauses. We've seen some things like early leaver penalties in some provider contracts. And by dropping the framework bid in, it means that you get that full range of education that the provider has promised to deliver. And equally, again, it makes it a lot easier, particularly for large organisations with procurement teams. It stops that heart-stopping moment when you're about to enrol 3 learners and somebody puts their hand up and said, how did we tender this? So coming through the framework means that's all been done for you. Next one, please. In terms, again, who we look after, and I made this point a bit earlier, it's anybody all the way through primary care. Liz and I are supporting primary care across the Midlands on some other standards as well, and we do in the Southwest and other regions. And private sector organisations. So if you've got services being delivered by partner organisations, particularly where you as a large organisation may be gifting levy, of course you want to know it's being spent with a provider that's going to have the desired outcomes for the reasons behind your levy gifting. So again, we can support all of that, and it makes sure there's that equity of provision right the way through the system. Next one, please. So covering this one, if there's any suppliers on the call, we did have a provider call a little while ago, but there's the links for providers to be able to go in once this is live, and the live date will go out on the Find a Tender service, which is a .gov website. And then for employers, next one, please. Again, this is some of the baselining that we do in terms of providers. So obviously they must be on ROAT or going through the application process when a conditional award's made. If they've had an Ofsted rating, it must be good or outstanding. Where they've had a monitoring visit, it must be significant or reasonable progress. And again, there will be circumstances where providers have had neither of those simply due to Ofsted's visiting programme. We will ask for apprenticeship rates achieved above the national average for that. And again, NHS terms are agreed through, and they must include that 1 resit per module and 1 resit at EPA without charge. And again, no additional charges for anything else within the programme. So it is capped at the levy top. Next one, please. Thank you. So next steps for employers. In the sort of week after this event, and I know we're capturing the Q&A from today, if there's any particular criteria you as an employer really think need to be in there that you'd really expect to see providers delivering, you're the experts in this particular programme, we're not, or I'm not personally anyway. And so again, if there's looking around how those delivery models would work for you, and to give you a bit of an example from elsewhere, where employers have included things like how they want the delivery method to be, sometimes it enables you to host maybe 2 apprentices instead of 1, because you're not having to cover backfill so much, etc. There's all that sort of support around. So if there's really key bits that you would expect to see a provider in there, please let us know. We'll include that in. Have a think about your potential learner numbers. All programs obviously have to have a certain sustainable level for providers to be interested. I don't think that'll be a problem on this one. There seems to be a lot of interest for it. A bit of advice where you've got functional skills requirements, we would always recommend you front load those. So again, whilst we're doing the procurement bit, that's a good time to start looking at what support may be needed. And Kirsty and Liz can talk a lot more about the support available from HEE, potentially for functional skills and for checking functional skills. And then the delivery models, etc., will be available, and we'll circulate those around to interested employers once the procurement is complete. Next one, please. The timelines on that, by the way, is we hope to have all this done by sort of end of October in terms of having a list then of providers who are offering the programme. If anyone needs any full information, do please drop me a note. These slides are going out, I think, with the recording anyway. But as I say, anything else, just drop me a note through and we'll always be able to help. Okay, thanks, Hannah.
Fantastic, thanks so much, Simon, and thanks, Kirsty and Liz. Alice, if we could flick back to 26, and I'll just rattle through some of the timelines for our implementation plans so that we can still have a big chunk for Q&A. I think we've been picking up quite a lot in the chat, but please, yeah, keep them coming. So I think slide 26. Yeah, preview. Yeah, the next one, thank you. So this slide just shows some high-level timeline of our implementation plans. As we said, we have already run an engagement event for training providers at the end of July. This was recorded, so if any of the providers would like access, please send them a link to our conference page, which is the second to last page on the slide deck. There's a link to that as well. They can access the recording on there and the slides, and we'll be then preparing for a procurement with all these training providers in September, and Simon's already talked you through those details. So behind all of this, we're preparing for the publication of an implementation toolkit, which will support employers, training providers and apprentices. So it will cover things like how to access the levy, how the procurement works, what an apprenticeship is, case studies, things like that. And we'll be asking for feedback at the end of today's session and through another Mentimeter for anything that would you'd particularly like to be included in that toolkit. So we are aware that some training providers already have cohorts ready with delivery plans and course specs in order. So we are expecting a number of different cohorts starting at different times. And we do need an EPAO in principle agreement before apprentices can start on the programmes. If you can flick to the next one, please, Alice. So Public Health England and Health Education England ran an employer demand survey nationally in July to support the implementation and give training providers an idea of that potential interest in the apprenticeship standard. So this slide gives you an overview of the data we've received. We had 92 responses in total. So these were mainly from local authorities. The bulk of that was, there were 34 of them, primary care networks, general practice. There were also responses from the voluntary sector, as well as mental health trusts, training hubs, private companies, community health trusts and acute trusts. So as Kirsten and Liz have already explained, HE will support employers to access the apprenticeship levy, with high numbers not knowing if they pay it, and also stating that they don't. There is the intention to upskill existing staff and recruit new staff, and there are rough estimates on the bottom left on the number of potential apprenticeship starts in 2021, 2022 and 2023 across England. Again, we just asked for kind of a general idea of the different job titles, listing the ones that were on the standard, so we could only list a few on the standard, but there are a huge array, and you'll see that one of the biggest categories was in fact other. So implementation is often a chicken and egg scenario, so we did also collect some information from the training providers during the July webinar. So they told us that likely cohort sizes range from 10 to over 50, but most were around 15 to 20 apprentices, and start dates range from October 2021. So there are a couple of providers who are part of the Trailblaze group who've already developed programmes, all the way to August 2022. So there's lots of opportunities for employers to tap into that. The majority were saying January 2022. So again, it will depend, going back to the chicken and egg, when employers are ready for that. Next, please. So we are continuing to work with NHS England on improvement and the Personalised Care Institute, where it says PCI anyway, that is the Personalised Care Institute. So we're looking at how we implement this apprenticeship and align all of our work. So this slide just summarises some of that work from NHS England and the PCI, including competency frameworks, the personalised care curriculum, which is linked when the slides come out, which is for universal application, and then potential registration that's being explored. So we are working with both NHSE and PCI to demonstrate how the apprenticeship and all these different competency frameworks and curriculum align to make that landscape really clear and to map potential career pathways and progression routes. So there's a lot more to do in this space as the competency frameworks develop, but so we'll just make sure that we share any details. This will become part of our contact list, so if you don't want to know, let us know. Next, please. So as a starter for 10, this slide kind of gives you an idea of how the community health and wellbeing worker fits into the family of apprentices that support public health careers, so coming from Public Health England. There is also a gov.uk collection that houses all of the progress reports, the consultations, the workshop reports, and it can all be found by Googling that title, Apprenticeships that support public health careers. Next, please. Oh, sorry, I think that slide is out of date. It has been approved as of yesterday. So this is a high-level diagram of potential career progression routes that we've started to map out, and it shows how apprentices go on to utilise further apprenticeships or career development. But this just shows some possible progression routes through public health routes in blue, and other routes through health and science, care, or business and administration standards. Again, our gov.uk collection gives further details of the public health standards in blue, but this doesn't demonstrate every route available. And there have been some comments in the chat about, is this just available to public health teams? It's not, it's across the whole sector, but being Public Health England, this is where my head's coming from. To give you just an idea of where we're starting, there is a lot more work to be done, as I've already said, on career mapping, and not just through apprenticeship standards either. So there may be opportunity to explore routes through coaching, leadership, management, or sector-specific things like nutrition or community sport. Next, please. So we are taking a systems approach to the implementation of the Public Health Practitioner Apprenticeship, which is the degree level apprenticeship. So, and it also may be a great next step for the level 3 apprentices. So HE and PHE's teams are coordinating employer interest to build cohorts and programmes in an employer-led way. So this slide shows some of the benefits of this way of working, and this may work for this apprenticeship as well. So this is just a couple of things to think about, get you all thinking. But working across the system might enable opportunities for apprentices to work across sectors in your local area, or as the ICS to allow them to build experience and gain exposure across sectors, enhance local partnerships, encourage innovative thinking. Approaching this apprenticeship as a collective would also enable support for other aspects like recruitment, manager-to-manager support, mentoring across the region or local area, a strong employer-led approach to the implementation. And something else to explore would be how the salary of these posts could be funded as a local system within a primary care network, or how the levy can be shared with smaller organisations. So how could these roles be supported by the new ICS structures to work across sectors, provide continuity across organisations, and build partnership working at all levels? As we've already mentioned, the apprenticeship can currently be used. The only apprenticeship that can currently be used by the primary care networks under the additional roles reimbursement scheme is that trainee nurse associates. So how do we support funding in other ways as a system whilst this is all being worked through? So these are just kind of conversations we can pick up and evolve. But apprenticeships do encourage recruitment from your local community and those who might already be working to improve health within the community, really passionate about their local community but may not have had the opportunity to access training. So we should be recruiting local residents who can use their local skills and knowledge and networks to promote health and wellbeing.